Aotearoa. I am Solmaz Nazari-Orakani, a postdoctoral research fellow at Victoria University of Wellington. My colleagues and I are conducting a research to explore health experiences of people with disabilities during the COVID-19 pandemics. We have just completed an initial analysis of our findings, and in this video I will explain our research, tell you about our initial findings and next stages of this project. I will start with the research team. As you can see in the middle of your screen, my colleagues in this project are Professor Karen McBride-Henry, Dr. Tara Officer, Dr. Michael Rogoski, and Dr. Gretchen Good. Why did we decide to study in this topic? As a disabled researcher, I'm passionate about conducting research that can be translated into the good policy and practice and ultimately benefits people with disabilities. I am also a disability advocate and have close connection with the disability sector. Very early in the pandemic, I faced difficulties in accessing healthcare as a disabled person. The response to the COVID-19 significantly changed the way I used to interact with the health system. New barriers were created, and all of a sudden, I did not have access to my usual care and support. In my interaction with the disability communities, I heard from my other members of the disability communities about the similar challenges and difficulties they had experienced. So I spoke to Professor McBride-Henry about these issues, and we decided to conduct a research exploring the experiences of disabled people accessing healthcare during the pandemic. We developed a proposal, and our research was awarded funding from the Lottery Health Research. The available research indicates that people with disabilities experience health inequities and poorer health outcomes. Natural disasters, humanitarian crises, and pandemics disproportionately impact disabled people and create poorer health outcomes. So continuous and uninterrupted access to health care is very important for people with disabilities. We started our research in early February 2022. First, we obtained ethics approval from the Victoria University of Wellington and the Ministry of Health and Disability Ethics Committee. Then we contacted several disability organizations and requested assistance with reaching out to the disability community. We are very pleased with the positive feedback and support received from disability communities, disability organizations, and people with disabilities and wider disability community. For the recruitment of this project, through our personal network and the help of disability organizations, so far we have interviewed 60 participants, including people with disabilities with a range of the disability and impairments and the parents of children with disabilities. Our participants have had many interactions with the health and disability system during the pandemic. As you can see, the column for the initial findings, our research indicated that the pandemic reduced and compromised access to health care and services for people with disabilities. There were some factors that make things worse, and some factors that help people with disabilities. We notice the pandemic has had some short-term and as well as long-term impacts on disability community. And besides general issues for people with disabilities, people with specific impairments were impacted differently. And finally, some members of the disability community were more vulnerable to the impacts of the pandemic because of the other factors. For example, income, employment, and housing. I will explain these findings in more details shortly. And what is the next for this project? We believe to facilitate positive change that benefits for disability community, people with disabilities should be part of the research. So we will run a series of the workshops with the community. Through these workshops, people with disability will verify interview findings to ensure our analysis reflects their experiences of their wider disability community, and the workshops people with disabilities will create a set of recommendations that they believe will improve the health and disability support system. We will use these recommendations in our final report to propose systematic system-wide changes that can improve the health outcomes of the people with disabilities. Now let's have a closer look to our initial findings. As you can see on your screen, the first column shows the 6 themes that emerged through our initial analysis. The second column includes some of the reported issues for each theme that was reported by people with disabilities. And the third column captured the voices of the people with disabilities. The first theme is reduce and compromise access to health care and support. This theme reflects the most significant impact of the pandemic on disabled people's access to health care. Many services and support were suspended or disrupted, and people with disabilities lost their usual care and support. The next theme is relates to the exacerbating factors. These are the factors that made it more difficult or impossible for people with disabilities to access healthcare. Some of these factors existed prior to the pandemic, and some of them were created by the pandemic or the response to it. For example, COVID-19 restrictions and policies, the health system being overstretched, and lack of planning and preparation for the disability community. The next theme is relates to protective factors. These are factors that made it easier for people with disabilities to interact with the health and disability support system. For example, knowledge and skills to navigate the system, family and funnel support, individualized funding, and good relationship with the health and disability service providers. The fourth theme covers short-term and long-term negative impacts. Disabled people told us about the negative impacts of the service disruption of their physical and mental health and well-being. We also identified reduced confidence and trust in the system. The next theme relates to the impairment-specific impacts. The disability community is very diverse. Some disabled people spoke about challenges and difficulties of interacting with the health system as a result of their specific impairments. For instance, for vision impaired participants, they told us about the inaccessibility of the drive-through GP visits or drive-through tests and vaccinations centers. And the deaf community told us about the communication difficulties they have experienced with mandatory mask wearing. And the last, but not the least, theme is the talks about the compounding vulnerability of disability community. Our study confirmed that people with disability experience a range of issues resulting from intersecting identities. For instance, lower employment, lower income, housing insecurity, and reliance on public transport. All of these factors impact their experiences, disability, and social interaction, including the health and disability support system. These were the initial findings of our initial analysis. As we go through our project, we will have more updates for you. And we are currently planning for our translational workshops that will hopefully result in good recommendation to improve health and disability support system. Thank you for listening.